and speak to you all if that's okay. So it's a little embarrassing to say that it was not until I met with Sandy and Vizu that I learned that this problem existed the way that it does, especially in the state of Mississippi. Medical school does not teach you any of this. You know, no matter where I rotated from Georgia to Nashville to Mississippi, no one ever stops to tell you that this problem is as big as it is in this state. We saw the statistics in the beginning, in the opening slides. The morbidity and mortality rate in the United States is not good. In Mississippi, it's really not good. If we took a deeper dive and looked in the Delta, it's unacceptable. It's unacceptable at the rate these people are dying. And they're dying deaths that are preventable. They're preventable. Everything I've heard here from perception, it matters. And never let anyone tell you it does not matter. And we all have to act as change agents for each other. If you recognize injustice, speak up for it. Speak up for it. That's the only way this will change, if we normalize this conversation. It has to be normalized. You know, it's time out for saying or pretending that these things don't exist. Regardless of your religious belief, your political beliefs, that needs to go in the back burner. It's about people. It's about people's lives. So the next thing, we need a program system change, as you mentioned. Care coordination in the clinic setting at Aaron E. Henry. Part of my job outside of seeing patients is the clinical medicine service coordinator. So what I'm charged to do is look for innovative ways that works for physicians that we can help coordinate services better for people. So chronic care management in maternal child health, like cardiovascular disease, these people are getting lost. So in the prenatal stage, okay, before their mothers, we kind of know what's going on with them, but we don't really know what's going on with them. They go through their pregnancy period, so they get their treatment there, you know, like they should. But after that, what happens? The patients with preeclampsia, the patient with gestational diabetes, these are people we need to monitor, we need to follow closer, but there's a gap in the care. So, yeah, their insurance issues, it's all about money. So we have to find a way to extend the workforce, and we have to rethink the way our system is set up, from the allied health to our medical education. Medical education in the United States, well, pretty much worldwide, has not changed in hundreds of years. Everything else is changing. We've learned how to train nurses in 2 years. We've learned how to train some nurses with a BS degree in 1 year. We've extended providers to be nurses to join the provider team with a year or two additional training. But MDs, our training has always been the same. An exam that I took just to check off my clinical works was used as board certification for a physician years ago. So if it worked then, it can work now. But it's time that we rethink our system. And it's gonna take all of us to do this. We need to use community health workers more. We need to integrate some type of specialized training, some type of curriculum, so that we can get the need met and expand the workforce.